Greetings to everyone. I'm Dr. Ashok Banskota from the Hospital and Rehabilitation Center for Disabled Children here in Nepal. I completed my MBBS studies from New Delhi, All India Institute of Medical Sciences, and went on to complete my orthopedic residency training in the United States. After qualifying, I've returned to Nepal and become intensively involved in developing orthopedic services for the people of this country. The Hospital and Rehabilitation Center for Disabled Children is an effort made to help the indigent children with musculoskeletal disabilities from the far nooks and corners of Nepal. The treatment is largely provided on a charitable basis. We take care of children under 18 years of age, and we do treat annually a several hundred children from bordering towns of India. So this is an example of great collaboration where I was able to go down south to complete my education and then move up north to America to acquire extra skills and come back to Nepal and help not only my own people but people from across the southern border. Interregional cooperations and institutions such as the United Nations are doing a lot to further enhance collaborative efforts that help underprivileged communities. What do we do? An example is the best illustration. Lakshmi is a 10-year-old girl from a very poor family. She sustained burns to her leg, which got auto amputated. She has a miserable childhood and has very bleak prospects of further life. Her mother carries her to school, a nearby village school, when she has the time, otherwise, she crawls behind other children. She's unable to interact and play. She's a sad little girl. Her life completely changed after HRDC, community based rehabilitation workers, spotted her and brought her to HRDC, where, after simple amputation revision, she was fitted with a artificial leg and for the first time has regained confidence to stand up and learn how to walk. Back home, she's independent, going to school by herself, engaging in recreational activities, and back on track to complete her education like other children. So we have brought her from this state to this state. I had the good fortune to go to All India Institute of Medical Sciences through the Colombo plan to complete my MBBS. So after completion of these studies, through interaction with friends and colleagues, I was able to enlarge my vision for further education, and through the National Internship and Residency Matching Program was able to get into a surgical orthopedic residency training program in America, which I completed and then decided to come back to Nepal to see how things would be like there because I had never really worked there. The transition was nothing short of drastic. I started work at a mission hospital, and the challenges confronting me on a day to day basis were extremely harrowing, challenging. Here is the example of a little boy who underwent a bilateral hip disarticulation after he became paraplegic through a accident. This boy had to leave home and was working in a tea stall by the roadside where something fell on his back when he was ferrying, helping passengers off a bus. So, having received no proper treatment, he came under my care 3-4 weeks after the injury with infection in both his hips, and the only way his life could be saved was by this extreme interventional procedure where both the hips were disarticulated and his urine and bowel were diverted. He was finally able to move around on a wheelchair sitting in a basket, but never able to regain that smile that we aim when we work with children. So The challenges are enormous. Day after day encountering problems like this was a stimulus for me to create a platform if this became possible to do better work. So Man Bahadur Rai is another boy who has never walked, suffering from contractures from poliomyelitis, and all this changed after he was spotted by our peripheral clinics, brought to the hospital, underwent a couple of operations. When this young man went on to complete his training as a school teacher and opened his own little school, and here he is with his family on one of our annual gatherings. So the challenges facing us at the time that I started my work were enormous. There were severe limitation of resources. There was no working platform. No systems existed. The pathologies were complex, presenting late, and the work volume was large and varied, and all this led to increasing costs of care, which was very difficult to obtain. So the disability adjusted life years for surgically treatable conditions is underestimated. In a study, more than 401 million per year. There is an epidemic of surgically treatable conditions in low middle income countries that receives almost no funding or attention. So this is where we first started our work, and we're located in this area for 7 years. We moved to an interim facility, very simple, continuing the services, and it was a question of abandoning services or doing something to get into a better planned facility to continue the work that was growing at an enormous pace. So with lot of effort and luck, finally in 1997 we have relocated to this location on the hilltop where our hospital is now providing services. I have been working from day one to train people at the paramedical level, at the surgeon's level, and this is a view of a small part of our team during one of our working days at HRDC taken recently. This is a larger, group. We have nearly 25 orthopedic surgeons on the team with varied expertise. There's nothing that we cannot treat, and we are able to do a lot of complex treatments under very challenging circumstances still with relatively little cost. Tankeswari is a girl from far west Nepal, didn't receive any treatment, walks on her fours, is ostracized by her schoolmates, and for a girl like this to survive and live in the community is a great challenge. So here she is when she was brought to our hospital after simple operative procedures. She's standing on her feet and recovering and finally able to independently walk. So this is what we do. We have coupled training and education as a part of our work so that the large work volume is now more easily addressed by a larger team. We have trained 33 orthopedic surgeons out of our program, and the training program in another capacity is still ongoing. So the work has been possible because of the associations that we have developed over the years, especially with regard to our funding, which is always extremely critical and shaky. The American Himalayan Foundation has been a close partner for over a quarter of a century, and I have been a guest at their annual gatherings in San Francisco several times. So we treat congenital problems, neuromuscular problems, trauma-related complications, burns and home accidents, tumors related disability, infection and complications, and lot of other miscellaneous complications that generally present late. Lot of the problems are preventable. So education, awareness drives are an integral part of our community-based work. Part of what we do requires appliances, artificial legs. This is a view of our workshop. It's divided into an assessment area, a shoe department, a orthotics department, and a prosthetics department. So with this combination, Our technicians are able to fabricate cost-effective, cheap appliances for our patients right in the house. There's a little girl with bilateral below knee amputation, and we fitted her with a very cheap, locally made prosthesis which costs under $25. Compare that with the carbon fiber prosthesis that is very, very functional, but this type of expensive item is absolutely unaffordable by our patients. So our community-based rehabilitation network spans the length and breadth of Nepal. We have small 5 satellite clinics. We spend about 150 days of field work per year. We have large number of staff, nearly about 80 staff that are dedicated to this work. We conduct few surgical camps. We do follow-up camps. We do awareness camps. We deliver appliances, and we also do school screening camps wherever these are deemed necessary. So the work done at the hospital becomes complete with the association with our community-based network. The challenges of getting to the community can be enormous in a country like Nepal, especially in the hilly areas where the roads are bad. The example of a clinic in far eastern Nepal in Okhaldunga, where I am also participating, this is an example of how things look like outside the camp, which is sometimes conducted in the open field, sometimes in a school room, sometimes in a health post, sometimes in a local hospital. Now, running a hospital like HRDC requires not only skills from a large team of doctors, which I have been able to develop, but it also requires someone taking on the responsibility. And this has become a reality for me with my son joining the team. This is Dr. Banskota, my son, who is an orthopedic surgeon like myself, and he has taken charge of the children's hospital as the executive director. He's a skilled surgeon. Now, besides providing all his technical skills, he's also taken on the responsibility to keep this program running and alive, looking for resources to make sure that the services continue and the future becomes more secure for the work that we do. So Vivek, like myself, went to India. He went to Jaipur at the Savai Mansingh, Medical College, from where he graduated, and then went on to the United Kingdom and a short while in America, and then came back and trained with me further, and now is a important part of our team. We identify, we treat, we rehabilitate, we socially integrate. We have a vibrant child protection policy, and we have a disability friendly hospital infrastructure which allows us to uh, take care of the children in a very compassionate and comprehensive way. Clubfoot is one of our most common congenital malformations that we treat. We have published and written on this experience from our own patient population. Our one-room school with 3 teachers keeps the children abreast of learning and education. So the children are in the hospital for an average of 3 to 4 weeks. Some spend several months here. So the school helps to keep the children, in touch with their education wherever they left off. The work has been recognized. We have been recognized by our American Himalayan Foundation partners as sterling partners. They have continued to provide us with some assistance for more than a quarter of a century, and this partnership is ongoing and strong. We have been awarded the World of Children Award, the World of Children Alumni Award, the Star Award by the Asia Pacific Group. The statistics are impressive. We have treated more than 90,000 children. We have performed more than 44,000 surgeries. We have fabricated more than 75,000 orthoses, and we have treated more than 10,000 children with club feet. We have graduated, 34 orthopedic surgeons, and we have trained primary rehabilitation trainees, numbers more than 500 now. To conclude, South-South, North-South collaboration has resulted in HRDC and its work. It tallies with the UN Charter goals related to the rights of every child. The HRDC work highlights the need for more resources to tackle disability resulting from surgically treatable conditions. Thank you very much.